by the way, just see if you want to give it a go. Just a heads up that we're recording this session. So for colleagues who are happy to stay on screen and camera, please do. You will see your cameras and mics are off, mainly just to help us with presenters, but there will be a bit of time later on to do a small bit of Q&A, if all things, and I chair this well. So once again, welcome as many of you land into the room for this morning's Virtual Learning Café, which is the launch of the Youth Endowment Fund's Youth Sector Practice Guidance. And colleagues here and everywhere I've been so far, lots of positive chatter about, great that the Youth Endowment Fund has put this together, and great that it's been announced. It's, many will say it's long overdue, and we say it's in good time at the same time. So I'm joined by a couple of colleagues who I mentioned, and you will hear from one of them more so. So we're joined today by Chloe Lowry, who is the Senior Research Manager. Chloe's just given us a wave. You're going to hear lots from Chloe. Chloe and I have had quite the partnership in developing this, so we're really proud. It's a great moment for us. And we're also joined by a number of really excellent external colleagues who we've partnered with in different ways and influenced together around the agenda of reducing youth violence. And so you'll hear from them throughout this session. So without further ado, and as people continue to land in the room, just a heads up that we are quite oversubscribed, and we hope everyone can make it in good time. And for those of you who arrived a little bit later, small apologies because we have to do some vetting. In terms of housekeeping, if there's any issues with the tech or any other issues, we have our team in the background who are ready to support and help us and make the calls in that regard. But great to see so many old colleagues now, having been here for 5 years externally, and new colleagues as well. So let's kick off this momentous day. If you're with me on LinkedIn, please do feel free to add me on LinkedIn and reach out. I did a little post which was magnificent because I was over at St George's Park where the England teams train, and did a joyous, momentous launch of the practice guidance in my own way. And I was taking a moment to look at some of the prolific names on the wall, John Barnes and others. And so I liken some of that excellence to where we're at now with the launch of this practice guidance, and it being a prolific, I think, supporter, enabler of the youth sector. So nicely said, we'll kick into the overview of producing the guidance, and then we'll move into hearing from Chloe. I also forgot to introduce Yanina. Yanina is our change and events officer who is helpfully flying the ship as I kind of pilot it. So I don't want to steal the praise or credit. Our hard work to get this to where it is, being a fantastic event, it must be mentioned. And to many colleagues across YEF who have helped in different endeavors to help us put this together, a huge thank you as well. So with that said and done, we are going to kick off with an overview of what we've been doing. If you've not come across us before, the YEF stands with a vision where a world where no child becomes involved in violence. And our mission is to find what works and build a movement to put this knowledge into practice. And you are here because you're part of the movement, and the guidance is part of what we know what works. And that's what we want to share with you today. So we are truly living out our mission and vision today. But before we get going, it's important just to have a reminder about the reality of our children and young people's life across England and Wales. And violence casts a long shadow over children's lives. And so we have our data team and our youth understanding team have put together quite a piece of work that tells us the stories of young people and their experiences. And so some of that includes that 1 in 79,000 of the population of 13 to 17-year-olds in England and Wales have been homicide victims. That's 64. Also, 500 are admitted to hospital due to assault with a knife or sharp object. 1 in 20 carry a weapon. They told us that they carry a weapon in our 2024 Children's Violence and Vulnerability Survey, which is live, and there are 5 reports. Go check it out. 1 in 10, and this one really is stark, our approach to sell, hold, or transport drugs or weapons. 1 in 10. Also, 1 in 6 have told us that they've perpetrated an act of violence, and 1 in 5 have told us that they are a victim of violence. And 1 in 2, which is half our children, have been a witness to real-world acts of violence. So from a young person's perspective, this is pretty damning of the place we're in that regard. And 1 in 2 say that the fears of violence have led them to change their behavior as well. So when we talk about reducing youth violence, when we listen to young people, these are the stats, data, the figures, the trends that help us to really resoundly, resolutely say this is something that we should, us as adults, should be taking consideration about. YEF isn't just thinking about the youth sector, but it's thinking about other sectors too, and producing guidance in each one of them. And so youth justice, policing, neighborhoods, families, health, and youth sector are the places in which we will provide guidance for colleagues. So when people often speak with me externally, they say, oh, but Caleb, what about this sector? And it's important for you to note that we're doing this across all sectors because we care about these 7 sectors together. So why focus on youth work? Well, 1, youth work engages children and young people who are vulnerable to violence. Children who have a trusted adult are twice as likely to have a youth worker than who are vulnerable than those who are not. And also, youth workers have a fantastic way in which to reach children from minority ethnic backgrounds as well, and vulnerable children. And so the CBV reports where violence was an indicator, children told us that they were in touch with a youth worker, with a mentor, with a sports coach, and these trusted adults. Secondly, universal youth services can protect children and young people from violence, and you'll hear much more about that in the recommendations today. And thirdly, specialist youth services can deliver effective targeted support. And so the golden thread of the report is youth workers. And although youth work is important and the sector is strong for reaching young people, youth work doesn't mean violence. Youth work is very good at working with young people who are at risk or involved in violence. And we want to separate the 2 things as upfront. And some of our recommendations will cover racial equity and racial equality and disproportionality, and the recommendations will also talk about ways in which we can play our part and contribute to reduce that. So what underpins the evidence? There are 4 key things that underpin the evidence. The first one is the YEF Toolkit, which is over 2,000 studies and available to us. For those of you who have been with us over the years, it's a rigorous independent summary of 39 different violence prevention strategies. Then we have 4 reviews of current practice. So that's youth clubs, youth sector funding, youth workers and their role in safeguarding, and A&E navigated programs. These were the gaps when we did the scoping exercise that told us that this is where we should invest and learn more. Then we have our annual survey of nearly 11,000 children and young people across England and Wales, which looks at the experiences of children and young people in violence. And lastly, we have Peer Action Collective, which is young people's experiences in their own words collected by peer researchers. And so this wonderful blend of voice, evidence, and gaps for research that we invested in and have led and driven the recommendations we've landed at as well. And finally, we have our wonderful external colleagues that we have been working with and have been advising us. So here are a number of stellar individuals who are really massive influencers in the youth sector world that we became members of our strategic advisory group that helped us to think about the real world context and to really think about how relevant and feasible the recommendations are. And they've been working with us for over a year, which so a huge thank you to each one of them for their contribution along the way, their time that they've given over to us. We really do appreciate it. And we're joined by a few of them or representatives of their organizations. So now I'm going to hand you over to Chloe to take us through the guidance. So over to you, Chloe.
Hi, Caleb. Thank you so much. And it's brilliant to have so many people on the call today. I'm going to be talking about the recommendations that we've developed and the kind of the actions associated with those. I won't be able to cover everything today. There's a huge amount in the report, lots of detail, examples, case studies. So I'd really encourage you after we finish today to delve into that report. It's available on our website. It's free. And yeah, just encourage you to delve into the detail there because we won't be able to cover everything. I'll start by kind of talking about the overall structure of the guidance. We've organised our 8 recommendations into 3 overarching themes. And these are the themes that we want commissioners, funders to be thinking about when they're thinking about the issue of violence amongst children and young people. The first is about getting the right focus. We know that commissioners and funders have limited resources. They can't do everything at once. And we also know that certain young people are more vulnerable to involvement in violence than others. So we're really encouraging commissioners to kind of get your binoculars out, really focus in on the places, the times where violence is most prevalent and the individual young people who would most benefit from support. Our second theme is approaches that work. There are 4 recommendations that outline a kind of individual approach that has been shown in robust research to be effective at reducing violence or offending. So we outlined 4 approaches that are effective, that are youth work approaches. And then finally, strong foundations. It's all very well to kind of get the right focus on vulnerable children and young people in high-risk contexts to, give them the kinds of types of youth work that can be effective. But we know that, many youth workers and youth work delivery organisations are struggling. And this theme is all about strengthening the foundations of youth work in your local area so that those youth workers and delivery organisations can provide the high quality support that will really make the difference to vulnerable children and young people. So to dive in, the first recommendation under right focus, and in fact this is our kind of only recommendation for this theme, is to target support where violence risk is highest. And this is all about ensuring that support follows need. Not all young people are equally vulnerable to involvement in violence. Some young people do require extra support, and it's vital that they get that support and they get that those kind of extra resources that they need. Now, you'll notice that to kind of help commissioners action this recommendation, we've got sort of 3 sub-recommendations, these kind of specific recommended actions to help you actually go about doing that, quite big ask, targeting support where the violence risk is highest. And you'll see that that's the same structure for all of our 8 recommendations. And if you open up our report, you'll see there's detail under each of those sub-recommendations. What I'm going to do today is for each of our 8 recommendations, pick out one sub-recommendation to delve into. It's been hard to choose. There's lots more about each recommendation in the report, but just so that we kind of make the most of the time that we've got today, I'll be focusing in on one sub-recommendation. For today, for this recommendation, I'm going to be focusing on the first sub-recommendation. You might say, okay, well, it's great to target support where violence risk is highest. Where is that? How do I know? And the key here is about identifying vulnerable children and young people and also the high-risk contexts. So you can see I've popped that in bold there as that's the one that we're focusing on. What we've done in the guidance and what I'll be talking about here is we've looked at the data from several large-scale surveys of children and young people to identify risk indicators that are helpful at kind of targeting support to vulnerable groups. And the first set of risk indicators that I've put up there are they're indicators that are available in administrative data. So children who are excluded from school are more likely to become involved in violence. Those who attend alternative provision, those who are severely absent from education, those who are looked after or in care, particularly if they're boys, and children with a criminal conviction. And these are risk indicators that actually you'll be able to see sort of, the numbers of children in the area that you're in who have these characteristics. And we really encourage you to get support to these children. When we've kind of identified these risk indicators, it's not that we're saying these are all the things that are associated with involvement in violence. There's quite a lot of things that have some kind of association with involvement in violence. But what we've looked here is at things that apply to a relatively small number of children and young people, and therefore is quite useful as a way of targeting support. So those are the kind of 5 administrative indicators. We really encourage you to get support, to extra support, the sorts of support that we'll be talking about, the approaches that work that we'll be talking about. Get that support to these children. But there are other indicators as well. These might not be things that are appearing in administrative data, but practitioners, youth workers might be aware of these elements in a young person's life. So this includes having numerous ACEs, which is adverse childhood experiences, things like witnessing parental mental illness, domestic violence, experiencing physical or sexual or emotional abuse. Having numerous of those adverse childhood experiences does raise a child's, is associated with involvement in violence. Substance misuse, that might be kind of being addicted to substances at any age. That's a really key risk indicator for involvement in violence. Or if a child at kind of quite a young age, in early adolescence, is misusing substances, drinking alcohol regularly, or taking any illegal drugs. Self-harm or suicidality is also a key risk indicator in the case of boys. There's you'll see this if you look at the children violence and vulnerability reports that we published at the end of last year. There's one particularly about mental health, and this came through really clearly in that for boys who are experiencing self-harm or suicidality, substantial, a kind of meaningful portion of them will also be involved in violence, kind of interpersonal violence. Then there's harm-involved social networks. So this might be being part of a kind of a friendship group that's in early adolescence regularly misusing substances or getting in trouble at school, or later on perhaps being in part of kind of identifying as part of a gang. That can also be associated with an increased risk of involvement in violence. And finally, experience of violence, being a victim of violence, carrying a weapon, having perpetrated violence in the past. These are all indicators that are associated with involvement in violence. If you've been listening to me carefully, you might have noticed that I keep shying away from saying, oh, that this increases that. These are associations, they're not necessarily causes. So those kind of 10 indicators we've got on the screen there, we call them indicators because they're an indication that a child is at risk. It doesn't necessarily mean that that element is what's driving the risk. In some cases, it might just be a signal that kind of something's amiss, and that child would benefit from extra support. So when we're talking about vulnerable children and young people in the report, and when we're talking about it later in the VLC, these are the children we mean, children who have one or more of these risk indicators. Although I've highlighted that these are really valuable for thinking about risk, it's also really important to notice that the vast majority of children in each of these groups won't end up being involved in serious violence. These aren't deterministic. It's support could backfire if it's designed around kind of labeling children as being at high risk, leading them to think, oh, I'm at risk of involvement in violence. Actually, that could have a negative effect. So support should always be focused on protective factors and increasing kind of positive outcomes for young people. So keeping that in mind and not seeing these as a sort of deterministic way of talking about children and young people. Equally, it's not just about sort of individuals. We also know that violence kind of clusters in particular times and places. So you should be focusing your work on identifying and changing the context in your area where harm occurs. So this might mean, for example, locations. Much violence happens in a small kind of number of places. If you look in kind of England, 50% of violent crime happens in 2% of street segments. So it's concentrated in areas that we call hotspots. And children and young people who live near those hotspots are more vulnerable to involvement in violence. And there's actually publicly available police data, we link to it in the report, that you can use to have a look at where those hotspots are in your area. It's also about timing. Violence is concentrated at particular times of day and times of year. For children and young people, the period after the school day ends between 4 and 8 p.m. is a particularly vulnerable time. And actually engaging children in something else kind of during that time can be protective. And there can be more contextual contributors as that are sort of specific to your area. It might be that social media is kind of driving or amplifying conflicts. It might be that there's a particular alternative provision setting where adults are targeting pupils there for child criminal exploitation. So it's about understanding and recognising what's going on in your area and how that might be contributing to violence involving young people. And I just put that quote there from a young person. This was collected by a peer researcher through our Peer Action Collective, that just highlights the impact that sort of these kind of local factors can have on young people, just sort of being in an area. And the evidence that we can see in other sectors does suggest that when we focus efforts on high-risk contexts, you don't just kind of shift violence somewhere new. It genuinely reduces violence. So we're encouraging you to think about the contextual factors that influence violence in your area. I won't spend long on them, but I'll just highlight the other two SAP recommendations here. The first is working with local partners to identify gaps. Kind of every sort of local area is an ecosystem, and there'll be sort of local authorities or other local authority departments and VRUs perhaps, and PCCs and metro mayors and housing associations, all of whom might be funding youth work in your area. So we're really encouraging you to start by understanding where the gaps in support are, not just the gaps in what you're funding, but the gaps in what's being funded in your whole local youth work ecosystem, and then working collaboratively with others to address those. And then the final sub-recommendation here is to commission in partnership with children and young people. Ideally, those children, young people who you're particularly aiming to support, so that they're kind of representative of the young people who you're hoping to actually have through the door of the support that you're designing, including those from diverse ethnic backgrounds. All right, I'll pause there, and hand back to Caleb, and we'll be hearing from our first guest speaker. Thank you.
Brilliant. Thank you, Chloe. Thanks for kicking us off there with recommendation number one. We are joined by the exemplar Dr. Junior Smart, who is a leader at St. Giles Trust, a violence intervention specialist and founder of the award-winning SOS Gangs program, drawing on lived experience to support desistance from serious violence and develop innovative interventions, and has it been influencing national public policy, has advised statutory agencies, and recognized recently for an OBE for outstanding work tackling youth violence. And it's wonderful to have Dr. Junior Smart join. Junior, do you want to say a couple of words about recommendation one and share some reflections on what this means to children and why commissions should act?
Hi there. I hope everyone can hear me okay.
We can hear you perfectly, Junior. Thank you.
Wonderful. I think, firstly, I just want to really say thanks so much for having me speak into this space. I think it really matters. I'm really excited about the recommendations and what the Youth Endowment Fund have done here. I think the reality is you only have to really look at the evidence, and this is something that the Youth Endowment Fund has been really good at, is collecting and disseminating the evidence. If you look at the work that's been happening, for example, in the violence reduction units, one of the things that that we know for a fact is that every single person at Martin Griffiths has, at least, I think it was, to start with, at least it was like 87% of the people he was meeting on the slab, as he called it, was known to other services. And this is the thing, the vast majority of people that we work with through our services, and I'm sure many frontline practitioners will recognise, already known to more than one service by the time violence becomes a concern. So really, when we see violence, what we're seeing is the violence is actually an indication of all of the times that we've missed to intervene. And I know that some people feel that, well, actually, when we talk about targeted approach, that means like singling out specific groups or targeting specific spaces. But actually, what we've just heard and we've understood is the need is to think contextually, to think in terms of times, spaces, people, individuals that are likely to be involved. And I think what we've got to understand is that violence just doesn't arrive without warning. I think that whole idea of seeing it within the context, I think that's going to be familiar to anyone that's working within this field. And we know, for example, things like that's already been said, you know, poverty, school exclusions, all of those sort of things weaken the protective factors. And I think the thing is, too often support is designed to either be evenly distributed or kind of like almost on like a postcode lottery, depends on what area and what gets the funding. I think having real targeted approach can be really, really important and effective. And so it's one of the things I really think is great about recommendation 1. I think it's to target support where violence and violence risk is highest. And I think that's going to be something that really matters really, really deeply. And I think the evidence consistently shows that vulnerability to violence, like you say, it comes in clusters, it overlaps with other things. And we can see, certainly for the services on the ground, we've seen the difference that it makes when trusted adults are present in really these high-risk contexts. I think at St Giles, this reflects what frontline practice continues to show, and that is when intervention is relational, sustained, and placed where risk is highest, it really can interrupt those pathways into violence and exploitation. And we're not talking about instantly, and we're not talking about neatly. You know, when we think about the reasons why people may become involved or the risks and the contextualized harms that are around it, it's going to be trauma. It's going to be impacted by trauma. And so therefore, I think any solutions aren't going to necessarily be neat or fit in these kind of like neat boxes, but I think in the ways that are going to be meaningful and lasting. I think one of the most powerful things about the recommendations is to talk about sustained support, and with that comes sustained funding. I think the reality is that the message out there for commissioners for funding cycles is that we need that consistency. And yeah, I just think it's really valuable.
Thank you so much, Junior. Lots of really aligning things said there, which I know your experience is really aligned to this recommendation. So appreciate your words there, and thank you so much for agreeing to speak here. Chloe, it's back to you for recommendation 2.
Thanks so much. The second recommendation that I'll be talking about now delves into this second theme, which is approaches that work. And we have 4 approaches that work that we talk about in the guidance. The first is youth clubs. And our message here is really, really simple. Close the most urgent gaps in youth club access in your area. The reason for this is that there's now clear evidence that youth club deserts, so areas where there's no youth clubs in an area kind of where young people live, do make children and young people less safe. So the first task here is that kind of sub-recommendation A, action A, which is to map existing youth clubs and identify deserts in your area. So figure out, where are the youth clubs in your area? Where are there areas where there are gaps? And we recognise, given that the enormous cuts in youth sector funding over the last 15 years, which have hit open access youth work in particular, there are going to be many gaps. There are going to be many youth club deserts in pretty much every area in the country. But this leads us to sub-recommendation B, which is the one I'm going to delve into today, which is to focus on opening new youth clubs in those areas where there are deserts currently, and where there are the most vulnerable children and young people, essentially those children and young people who we've just been talking about in recommendation 1. And the reason that we're really encouraging you to open youth clubs to support vulnerable children and young people, even though youth clubs are kind of open access, universal services, is because of the clear evidence that vulnerable children and young people attend youth clubs in high proportions. You can see data there, that graph. This is based on data from our Children Violence and Vulnerability Survey. It's a representative survey of over 10,000 teenagers across England and Wales. And you can see, and this was a simple question, kind of, do you attend a youth club at least once a month? And you can see children who had certain kind of risk factors, like using drugs, being supported by a social worker, interacting with the police over a suspected offence, being at risk of child criminal exploitation, carrying weapons, being excluded from school, being affiliated with a gang, were much more likely than children without these risk factors to say that they attended a youth club. And you can see that really powerful quote there, again, a quote from a young person collected by one of our peer researchers through the Peer Action Collective, talking about the impact that the youth club had on sort of them and their friends, and the kind of lack of the youth club that they can now perceive. So while some children and young people, with these risk indicators are benefiting from attendance at youth clubs, not all of them will have access to one. So this is about improving that access, and because resources are tight and because the need is so big, needing to prioritise the most vulnerable. So this is about focusing on areas where there isn't a youth club. In a kind of urban area, as a rule of thumb, we can consider that an area where there's no youth club within a 40-minute walk. There'll be a lot of areas that meet that criteria, but you can kind of prioritise by thinking about that element of vulnerability. And one clear way to do that is by thinking about the distribution of violence in your area. There's publicly available police data that you can use to identify areas, kind of very small hyperlocal areas that have high levels of violent crime. So I would look at that data and look at sort of groups of those hyperlocal areas and see actually, where is there high levels of violent crime? Are there youth clubs in those areas? And within those sort of overall neighbourhoods that you've identified as being priorities, choose that new location of a youth club carefully. You might want to avoid, putting the youth club in sort of the most immediately violent, street that you can see in the data. It's really important to ensure that attendees and youth club youth workers and staff are safe. And you want to think about, sort of all of the elements that might affect whether young people attend. So transport, what are the transport links? What are the transport costs? Where are the local secondary schools or alternative provision settings? Are they nearby? How might a young person's fear about violence or postcode conflict affect, them travelling to a potential youth club location? So speak to children and young people, speak to practitioners, speak to school leaders in the area about the kind of benefits and drawbacks of a potential location. Once you've sort of decided, okay, this is the spot for the youth club to go, make sure you provide sufficient funding so that the youth club can offer really high quality support. This is about it being able to open every weekday after school, between 4 and 8 p.m. during that key risk time. It's about maintaining high enough staffing levels so that children and young people can actually interact meaningfully with the staff. It's about training staff, so making sure that they all have training in safeguarding, relationship building and maintenance, local services for children and young people, support for themselves, that they understand where to access support for themselves if they need it, as well as understanding some of the more kind of specialist issues, which I'm going to be talking about a bit later. And the final thing is we'd really encourage you to offer targeted support within the youth club. This can be a non-stigmatizing way to get extra evidence-based support to vulnerable children and young people. This might just be about, the youth workers in the club themselves offering that additional support, like mentoring or structured positive activity programs, or it could be through co-locating services within the youth club. So, situating mental health services or substance misuse services within that club to enable those young people to access it in a way that they might not otherwise. Then that's kind of sub-recommendation B. I'll just talk briefly about C and D. We don't just put the emphasis on opening new youth clubs. If you read the report, we'll see we're encouraging you to increase funding for existing youth clubs where possible. This might be, making sure they can open every day, increasing the number of staff in the youth club, improving their training. And we recognise that existing youth clubs will have those sort of inbuilt networks and trust within the community that a brand new youth club just won't have straight away. And finally, actively publicising the local youth offer. When you talk to children and people, what we've seen from multiple sources of research is that they say they don't actually know what's there in their area. So this can be a really kind of low-cost way of actually improving access, is just by improving that advertising and awareness of what's in the area. I'm going to be handing over now to our second guest speaker, Abby McClatchy. I'll hand over to Caleb to introduce her. Thank you.
Brilliant, superb. Thank you for that, Chloe. Welcome, Abby. Abby is the Deputy CEO at the National Youth Agency, who is leading national professional standards, training, curriculum, safeguarding and quality frameworks. Abby has decades of frontline experience and a strong commitment to identity and issue-based youth work that enables young people to drive social change. Abby, welcome. What are your comments on this recommendation in terms of what it means for young people and what commissioners should act on?
Thanks, Caleb, and thanks, Chloe. I'm always a bit disappointed when I have to go after Junior. I think I better just get that in there because it's always so much to live up to. So it was great to hear from Junior there. Okay, so I've been asked to focus on recommendation 2, which is around closing the most urgent gaps in youth club access. And what I really wanted to talk about is why this matters so much right now in relation to what's come out from the YEF research, particularly in the context of what it's like being local authority commissioners or different types of commissioners and some of the tight budgets and really difficult commissioning decisions that you're having to make. What I wanted to do was highlight why investing in closing the gaps in youth club access is a really smart, really sensible thing to do for our young people and for our communities. So we're operating in a landscape, clearly, as we've seen from the research, where demand is rising, complexity around young people's lives is definitely increasing, and resources are really constrained. But I'd argue strongly, and I'd really advocate strongly for you to think about that this is exactly why youth work matters more right now, rather than less, in your commissioning decisions. Youth work is one of the few really cost-effective, preventative, multi-purpose interventions that we have at our disposal to support young people. It doesn't just do one thing. It protects young people, it connects young people, it stabilises communities, it identifies risk early, and it reaches young people that many other statutory services just struggle to reach. And that's particularly relevant when we're talking about young people that are marginalised, that might be criminally exploited, or simply aren't even visible until crisis hits. Junior made a point when he was talking about, and I think he said something along the lines of, violence doesn't just happen, there's always been a context. And I think that links us really well to thinking about things like contextual safeguarding too, right, and the role of youth work in this space. Colleen Thurman's framework talks about young people that are known to services, and actually we're often talking about things that are a bit too late at that point. And what youth work really does is it talks about young people having the opportunity to be known by professionals, which really then situates this work in prevention rather than cure or solution, and that's what we're trying to focus on. When we're talking about youth clubs, we're not just talking about buildings, we're actually really talking about relationships. And I saw some stuff in the chat about this, right? It's about what's happening in those spaces that are really key. We're talking about relationships, we're talking about trusted adults, and we're talking about skilled workers. The building's absolutely an anchor, but it's the people and the practice that are really making the difference for our young people. So recommendation 2 really asks us to be bold about something that's actually quite deceptively simple. It's talking about access to these people and places, right? And I guess my challenge to you is, do your young people have access to trusted relationships, safe spaces and consistent support? And do they even know where to find it? So the evidence that's in this report is really clear. Youth clubs are not a nice to have, it's part of protected infrastructure. When access to youth club disappears, harm increases. When it exists, particularly in the right places and at the right times, with the right workforce, it reduces violence, it improves safety, and it's a gateway to wider support, which is really key. Importantly, though, as I said, access doesn't always just start with the front door of a building. Youth workers are relational practitioners, right? That's the bread and butter of what we do. So often, youth workers might come from a youth club, but actually they're engaging with young people through outreach, right? So they're going from that building out into estates, parks, schools, APs, community spaces, and they're building trust with those young people in those dangerous times and in those spaces and bringing them into a place of safety. So for most of our most vulnerable young people, that relational bridge from the relationship is what makes access to these spaces possible in the first place. So as local authorities, commissioners, systems leaders, you already have a statutory duty to secure sufficient leisure time activity, so to secure youth work for young people, like that's in the Education Act. And also to map what's going on there and to publicly set out your local youth offer. But I know how hard that can be. And often that duty kind of becomes a bit of a secondary thought or a compliance exercise rather than a strategic lever that you've got at your disposal to really interrupt cycles and patterns of violence. Mapping provision then isn't just about counting buildings, folks. For me, it's about understanding where the relationships exist, where they don't, and where you might have young people that are falling through the gaps. So publishing your youth offer, whether it's you that's delivering it or whether it's you that's commissioning it, or whether you just know about really good youth work that's happening in your communities that might be an absolute lifeline for young people, all of this is a key part of your safeguarding. If young people, families and trusted adults don't know what's available where they live, access just becomes theoretical, right? And what we've seen more recently is the National Youth Strategy, Youth Matters, is really, really clear about this. It positions youth work, youth clubs as central to early interventions, place-based delivery and prevention. And as Chloe mentioned earlier, we're particularly talking about young people who are the most marginalised and excluded and facing the greatest disadvantage. And youth work isn't at the margins of that strategy, it's absolutely at the heart of it. I want to finish off by talking about funding, because I know that it's something that's absolutely at the heart of a lot of the conversations that you're going to be having about this stuff in your own workplaces. Tight budgets should not push us towards short-term, fragmented, crisis-based responses. They should push us towards interventions that do multiple jobs well. Youth clubs, if we're thinking about them as relational, flexible and rooted in communities, will do exactly that. We know that safeguarding happens in youth clubs way before thresholds are reached. Exploitation gets noticed early, at the very first moment. Trusted adults hold that risk, they challenge harm, and they're connecting young people into the right support when they need it, sometimes without even needing escalation into those super expensive statutory systems. That's not expensive work when you compare it to the cost of failure at the end of this journey. So my challenge and my encouragement is this: be really brave with how you enact recommendation 2. Use it as permission to rethink how you commission youth work. How are you pooling your funding across different areas? How are you supporting outreach and buildings? And how are you really valuing open access youth work as part of your core local infrastructure, not as a discretionary add-on? So if we're serious, and if you're serious about protecting the most vulnerable young people that we care about in our communities, youth work shouldn't be optional. Youth clubs are one of the smartest, most human and most effective investments we will ever make in our young people. And if you want any help and support with thinking about how you do those things, there's plenty of us around in infrastructure bodies, nationally, regionally and locally, that will help you to do that. Thank you.
Thank you, Abby. Strongly put. Junior and Abby kicking off the day. It just gets better. It just gets better. And if I could use one sentence to summarize what you said is, the building is an anchor, but people are the asset. Invest in the asset. That's what we do in everything else, right? And Chloe, back to you. Thanks, Abby.
Thank you so much. The third recommendation I'm talking about now is mentoring. And we really encourage you to raise the standard and reach of mentoring in your area. And the kind of why for this is simple. Vulnerable children and young people need trained adults, trained mentors who stay long enough to earn their trust. As we've kind of highlighted already, the lives of children and young people who are vulnerable to involvement in violence and who do end up involved in violence are complex, and can't sort of a sort of quick one-off intervention isn't generally going to fix that complexity. That support, those mentors are really trained and equipped to do that. The first recommended action here, which is the one I'm going to be focusing on, is to map mentoring provision and identify gaps. So the start is to kind of map all mentoring provision for the vulnerable groups who we've discussed so far in your area, whether this is provision you're funding or provision other people are funding. There's likely to be wide regional variation here. Research that we've commissioned that looked at 360 giving grants for mentoring found huge regional disparities, with much more funding, say, for mentoring in London than in other areas. When you're sort of thinking about mentoring doesn't need to be focused on violence in order to prevent violence. There might be a mentoring scheme that's focused on employment opportunities for young people who've been excluded. That's likely to be doing really fantastic work to prevent violence, even if no one ever talks about that or no one ever frames it in that way. So mentoring that's reaching those vulnerable groups who we've discussed is likely to be preventing violence, even if that's not an explicit focus. When you're thinking about mentoring as well, we recommend focusing on programs that explicitly match a child and a young person with a mentor and enable them to meet regularly, where kind of both the mentor and the mentee understand that this is mentoring and that's what's going on, not just a sort of trusting relationship that might evolve in another context. We will be talking about the value of those in a moment, but here we're talking about kind of specific mentoring programs where that's the central focus. When you're doing this, when you're mapping provision, draw on existing work, talk to local partners about what they're funding, what mapping they've already done. So this might be about, one local authority department talking to, the other local authority departments who also have a stake in the kind of welfare of young people. It might be about talking to VRUs or PCCs or local schools, and aim to complement, not to duplicate what's already going on. You can use online databases to help you figure out what's already being funded in your area. If you go into the guidance, there's a list of, I think, 7 online sources that might be helpful for you to understand actually and audit what's already going on in your area. So one example is the National Youth Agency Census, which has huge numbers of youth organisations on this interactive map. There's also the 360 Giving database, which I mentioned earlier. And finally, focus on identifying gaps in provision. So think about where mentoring is geographically distributed in your area. Think about what the referral routes are. Think about the eligibility criteria and kind of programme focus. So there are lots of programmes focused on school exclusion, but nothing focused on young people with substance misuse. Vice versa. Think about the settings where mentoring is already taking place. Is it in alternative provision? Is it in youth clubs? Is it taking place at home? So thinking about gaps, really holistically. And then as well, thinking about the overall quality of support provided, which is described in much more detail in the kind of recommendation B, which I'm afraid, because of time, you'll have to consult the report to get into the detail there. I'm going to move us straight on to the next approach that works, which is positive activities. And we really encourage you here to maximise the protective power of positive activities. I'm sure so many of you are already funding positive activities, and we encourage you to think about them not just as something that can kind of keep vulnerable children and young people busy, although that's an important aspect, you know, to keep them busy at times when they might be vulnerable to violence, but they can do more than that. They can build social and emotional skills, they can build relationships with trusted adults. So we're encouraging you to fund a range of structured positive activities. We say here including sports, that's because there's specific evidence, direct evidence that targeted sports programmes can be effective in reducing violence and offending amongst young people. And we don't have that evidence for all types of activities like arts programmes, for example. But the mechanisms that make sports programmes effective are likely to apply to other types of activity as well. And we know that young people often have better access to sports than to things like arts or adventure and wilderness activities. So think about the kind of range on offer in your area. Then we encourage you to offer vulnerable children and young people at least 6 months of weekly positive activity sessions. So that's sustained support that both Abby and Junior have been talking about, and ensuring those adults are safe and trained as well, because keeping in mind they are working with really vulnerable children and young people. And then I'm going to delve a bit more into C, which is funding provision that builds social and emotional skills and trusting relationships. And I wanted to share two case studies which we feature in our guidance report, Audioactive and Delalia Rugby Works. These are both programmes that we're funding robust randomised control trials of that will report next year. So we're robustly evaluating the impact of these programmes. But I wanted to highlight them at this point because I think they're really good examples of combining positive activity. In Audioactive case, that's music making, and in Delalia Rugby Works, that's rugby. But a really great example of combining positive activities with formal mentoring or social skills training. So in the case of Audioactive, the SHIFT programme offers music mentoring sessions for 11 to 17-year-olds who have offended or at significant risk of offending. And these are delivered over 6 months. They're one-to-one in-person sessions that are really tailored to the goals and interests of the young person. And the sessions combine this music making with work on emotion regulation, employment, behaviour, education, careers. And that music is a way of kind of unlocking the deeper issues that a young person might be experiencing, as well as building that trust with their mentor. So combining a kind of positive activity with mentoring can be a really good way of engaging young people and giving them opportunities to express themselves and develop social and emotional skills. Another way you can make the most of the potential of positive activities is to combine them with a clear kind of social and emotional curriculum. Delalia Rugby Works does this. It's a programme for 11 to 16-year-olds who've been permanently excluded from school or repeatedly suspended, and it runs over the course of an academic year with these weekly non-contact rugby sessions that focus on developing teamwork, communication, problem solving, self-management. And there are also these 18 workshops over the course of the year that focus on things like employability, digital skills, mental well-being. But you don't, and I want to be clear on this, you don't necessarily need to have an explicit mentoring or social skills component for positive activities to foster children and young people's social and emotional development and trusting relationships. It might be a really good thing that you want to think about, but even if you don't end up doing that explicitly, another route is to kind of focus on having high staffing levels so that the staff can spend quality time with each young person, ensuring that staff are really well trained and equipped, because then they're more likely to be able to kind of bring out the social and emotional opportunities that arise in the course of a positive activity. Opportunities for managing conflict, managing disappointment, kind of expressing emotion, developing empathy. These things sort of arise in the course of activities, and experienced staff may be more likely to make the most of those opportunities. And just as an example, in the Delalia Rugby Works programme that I'm talking about, there's a maximum of 2 coaches to every 16 children and young people. And all of the coaches have a youth work or a sports coaching qualification. They also receive at least 2.5 hours of supervision every month, and they complete 150 hours of additional training during their first year, so covering safeguarding, adverse childhood experiences, special educational needs, child criminal exploitation, and serious youth violence. So it's about ensuring the staff are actually equipped to support young people, whether that's through a sort of more formal mentoring or social emotional curriculum, or more kind of organically through the activity. That's everything for recommendation. Well, not everything, so I couldn't go into everything I'm going to say today about recommendation 4. But so that you don't just hear from just me, I'm going to hand over to Caleb, who's going to introduce Jacob Diggle, our third guest speaker.
So we're going to welcome Jacob to make comments, who is a fantastically astute individual and a Chief Impact Officer at UK Youth. And Rosie, and formerly Ndidi, has been involved with the advisory group. He is the UK infrastructure body for youth work, that's UK Youth. And Jacob leads the charity research, evaluation, service design, and policy work. Jacob has led major studies of youth work's impact, including 2022's study on which is called Untapped, modelling the economic impact of youth work. Prior to joining UK Youth 4 years ago, Jacob led the research team at Mind, the mental health charity, and has worked on youth unemployment policy with Jacinda Ardern, formerly the Prime Minister of New Zealand. So, Jacob, what does this mean for young people, and what your commissioners and local funders do about it? What are your comments?
Thanks, Caleb. And I'm so delighted that I get a chance to talk about this recommendation in particular. There's a huge amount of work and richness in the guidance that the YEF have produced. And the fact that I get to talk about the protective power of positive activities makes me incredibly happy, because I think these are things that have not really had the serious attention that they deserve. Positive activities are not just about keeping young people busy or out of the way. They're a core part of how youth work unlocks potential and prevents harm. And just because something is joyful doesn't mean it's frivolous. And fun is not a nice to have when we're thinking about supporting the most vulnerable young people. It's how trust is built, it's how confidence is earned, it's how essential skills are setting up young people for life. This is serious fun, and it's really important, and I'm so grateful that the YEF are taking fun seriously. As Chloe was setting out, the kind of high quality positive activities supported by youth workers, where trusted adults are there to support young people, can have a profound and life-changing impact. Really powerful ways to build social and emotional skills, help young people form trusting relationships with adults in their life, but also with their peers, with other young people, help them feel safe and supported and like they belong. And crucially, as we're now seeing with the evidence that the YF is setting out, we can say that these activities are reducing the risk that young people get drawn into violence. When we think about the kind of opportunities prevented by positive activities, whether those are in youth clubs or in sports or arts settings, they can be really profound ways for young people to learn about themselves, to build strong friendships. Importantly, as Chloe was setting out, to challenge themselves too. Just because something is joyful doesn't mean that it can't be hard. And actually, a lot of what the kind of transformative effect of positive activities can be is when young people are really stretching themselves, sometimes failing in a safe context, and learning how to manage that. The kind of key skills around conflict resolution, emotional management, problem solving, teamwork, these are all things that are, we know, protective against being involved in violence, but also that will set young people up for success in their lives more broadly. These are the kind of core essential life skills that we know employers are looking for, that we know make people feel able to positively contribute to their communities throughout their adult lives. But the bit that I really want to fundamentally emphasize is, I think we can, when thinking about kind of positive activities, we want to point out the skill development and those aspects, but we really shouldn't overlook the the importance of joy and pride and the importance of being witnessed and seen by your peers. Fun and joy is an important part of, well, should be an important part of all of our lives, but particularly as you are coming into adolescence, that, you know, just because you might be at risk of harm doesn't mean you aren't entitled to have fun in your lives. And these are so important and radical that are taken very seriously. I think the really important point to emphasize here about positive activities is young people are different and they're going to be interested in different things. And it's really important that young people have kind of meaningful choice and control about the kind of positive activities they're involved in. Not everybody wants to do the same kind of activity. And so ensuring that there's a range of positive activities available for young people is absolutely crucial. But I think sometimes we can get a bit distracted by the detail of specific activities. And it's one of the things that we get asked about a lot from people who are kind of less familiar with youth work, and they kind of get a bit confused. So there's this youth organization over here that's doing sports stuff, and this one's doing art stuff, and this one's seems to just be a kind of drop in and seems to be unstructured. This one's outdoor learning. Like, how's it all the same thing? Because people are getting quite focused on the kind of specific of the activity rather than the kind of golden thread that unites all of that. You know, what all high quality positive activities share is the kind of opportunity for a trusted adult, a youth worker, to work shoulder to shoulder with a young person. That positive activity might make the young person want to continue to engage, keep showing up, might provide opportunities for youth workers to help young people reflect on key skills. But if they're having fun, they're doing an activity that they're enjoying, and there is a trusted adult alongside them who's got the skill and the time and the resource to work shoulder to shoulder with them and support them, that's where the profound change really happens. I guess in terms of the implications for commissioners, I think the recommendations here from YEF provide a really clear blueprint, investing in high quality youth work and positive activities that specifically aim to build essential life skills and develop these relationships with trusting adults is critical. That's not something that you can shortcut. Building trust and building trusting relationships takes time, and the YF recommendation is absolutely critical here, talking about at least weekly sessions for at least 6 months. This long-term funding, this long-term view about young people, cannot be understated. Young people need support that lasts months or even years, because short-term projects that end just as trust is forming can be harmful themselves. These can be yet another example in a young person's life of adults who have let them down, or people who move in and out of their lives and they're left on their own again. Vulnerable young people need consistent adults in their lives, not a kind of revolving door of provision. And as Abby said earlier, when funding is tight, don't be misled in thinking that short-term or light touch is cheaper. Right, there is nothing more expensive than wasting your money. And if you're funding short-term activity just to give a cycle, a flurry of work that doesn't actually change anything, that's a complete waste. And so we all know that prevention is cheaper and kinder and more effective than crisis intervention. And the evidence is really clear, and I'm very grateful for how clearly it is set out by YEF. Youth clubs, sports and arts activities are a lifeline, not a pastime. And we shouldn't shy away from funding regular and long-term provision, because young people don't need programs that rotate. They need adults who are going to remain in their lives, who've got the time and resources to take them seriously and to work alongside them. And when money is tight, that's the thing to invest in, because that's what works.
Thank you so much, Jacob. The line I take away from what you've said there is, fun can be used to make a difference. It can go deeper, and if targeted, can make a difference for vulnerable children, and so much more said. So appreciate that commentary and response, Jacob. Chloe, back to you for recommendation number 5.
Thank you. And this is our fourth and final approach that works. which is A&E Navigator programs. But our message to you is might not be kind of what immediately pops into your head when you think of A&E Navigator programs, because what we're asking for here is embedding sustained support in high need A&E departments. This is because, as Jacob's just been speaking about so eloquently, vulnerable children and young people need ongoing follow-up support, not kind of a brief signposting intervention, which is more kind of similar to what some A&E Navigator type programs offer. When I talk about an A&E Navigator, if people are not familiar with that, I'm talking about services that place a caseworker, who's often called a navigator, in an emergency at department to support children and young people who are admitted there with violence-related injuries. Caseworkers come from a range of backgrounds, including youth work, education, healthcare, so they're kind of relevant to what we're speaking about in youth work, but also relevant more widely. For this recommendation, I'm going to dive into the first sub-recommendation here, which is targeting support to the children and young people who need it most. Just as an overview, the research we conducted that helped inform our recommendation here found that A&E Navigator services were available in over 40% of English hospitals and 17% of Welsh hospitals. Overall, they tend to be located in areas that have higher levels of violent crime and higher levels of deprivation. But if you look at kind of, the sort of top third of areas in the country that have the highest kind of levels of violent crime, over a third of them the hospitals in those areas don't actually have a navigator services. So there are gaps here. And we really encourage you to focus on those hospitals that see the highest numbers of vulnerable children and young people. There's a link in our guidance to an interactive map that's based on this research that actually shows, you can look at what's on the map is the hospital catchment areas. So they're not local authority areas, they're the catchment areas surrounding each hospital. But you can look at the hospitals near you, those in your area, and actually see what's the rate of violent crime in that area, what's the deprivation, and is there actually already a service there. There are other ways of kind of building a picture of needs, so talking to local health partners, getting anonymous data on kind of admissions for different presentations in the A&E department, talking to safeguarding teams, seeing how many kind of safeguarding referrals or child protection strategy meetings involve each hospital, but build a picture of need in your area and then focus resources where that need is highest. Second point here I want to draw attention to is actually consider expanding eligibility criteria to not just include children with violence-related injuries, but to also include children who are admitted due to substance misuse, self-harm or suicidal ideation. And that goes back to what we were speaking about in recommendation 1, that these are all important risk indicators for involvement in violence. So it's important to provide support for those children as well. I'm aware here that if you're increasing the eligibility criteria, that means more young people eligible for the service, and that's going to put strain on services. But I think it's really worth thinking about whether there's possibilities of securing additional funding, for example, from integrated care boards in England or local health boards in Wales, to support more referrals and to train caseworkers in these issues, especially if services are providing support for more health-related presentations like substance misuse or mental health difficulties. Final point I want to make here is to not restrict support to a kind of model that assumes that it's only relevant to young people who are experiencing a kind of teachable or reachable moment. Don't limit eligibility criteria to young people experiencing an acute event like a violent related injury or an overdose. Children, young people who have long-standing vulnerabilities to involvement in violence, for example, having had numerous adverse childhood experiences, they may also benefit from support. Now, that might be less obvious in hospital data, but it might be that caseworkers or hospital staff become aware of these vulnerabilities, and services shouldn't be restricted to just providing support based on an idea of a kind of teachable or reachable moment. If I think Caleb's going to pop in the chat a link to that map that I was talking about, if you're interested in checking out the kind of presence of A&E Navigator services in your area. As well as targeting support, We encourage you to make caseworkers available in the right places and times. So they're available in the A&E department, not just sort of more widely in the hospital or even outside the hospital. And they're available at the times that young people tend to get admitted to hospital, which often isn't, 9 to 5 during the week. We encourage you to combine sustained direct support from that navigator who a young person met in hospital where possible, to access to other evidence-based interventions as well. Things like cognitive behavioural therapy, things like youth clubs, mentoring, positive activities, so that young people are kind of able to get that wider support. And finally, our final recommended action here is really to equip caseworkers for the demands of the role. It's a demanding role, being a navigator, and often navigators kind of struggle to have that sort of authority in the hospital to access medical records, even to kind of have colleagues within the A&E department be aware of their presence. So really thinking about making sure caseworkers are equipped to do that role. I'm going to hand back to Caleb, who's going to introduce our fourth and final guest speaker, Lib Peck.
Thanks, Chloe. Lib, welcome. It's great to have you here. Lib is the first director of the Mayor's London Violence Reduction Unit, set up in 2019. Lib was formerly the leader of Lambeth Council, and Lib has extensive leadership experience across London government, prevention, VOG, and the voluntary sector, and is an incredible human being. So, Lib, over to you.
Great, thank you very much. And with all those accolades, and thank you very much for them, Caleb, we still managed to have a blooming awful photo of me. But anyway, I really appreciate the opportunity to speak and have been really engaged in the YEF work. I'm going to start with a statistic, which is at the end of last year, the number of 25-year-olds killed was at an all-time low as compared to the beginning of the century. So that's quite a dramatic drop for us over that 25 years. And I want to do so not because I want to be congratulatory, because we know far too many people still suffer the trauma of murder or violence. And I also don't want to do so and appear tone deaf to the perceptions of safety. But why we have promoted that statistic and many others in London is to enable us to give space to a process and an approach that has been both prevention and enforcement, and to finally get that kind of space in public discourse that prevention has to be an incredibly important component of anything that is reducing violence. And as soon as you get into that space, and as soon as you move away then from just reduction of violence and start thinking about what is positive, I think the role of youth workers, trusted adults, mentors becomes absolutely fundamentally important. And that's why I welcome in particular this research. Now, I've been sort of asked to speak a little bit on the hospital-based youth work recommendations. I would say that having listened to all the contributors so far, there are very clear themes that emerge. And I think one of our challenges is to make sure we don't become too programmatic in conveying a much broader case of why prevention is important. But I am going to start by saying, since 2019 until now, and so the last 7 years, of which we've had a VRU in London, we have seen a 44% reduction in hospital admissions for under 25s as a result of knife assault, which is a really, really key stat for us, and important in the context of now talking about hospital-based youth schemes. The first is clearly this is collective effort. And I see us as a violence reduction unit as an investor, not a funder. And I use that word investor very deliberately, and I'll come on to that in a minute. We have a reach into the 12 hospitals across London. To take your point, Chloe, we could have a reach that's far wider, but the 12 hospitals contain the 4 major trauma units. And we work very, very closely alongside, in partnership with Oasis, St Giles, Catch-22, Red Thread, who actually deliver that service, and more than 5,000 young people have hopefully benefited from that. The recommendations, I think, probably fall into 2 parts, and the first is really about what I would call the relationship part. of this that makes it so magical when it all aligns, and that is the connection and the skilled connection between the adult youth worker and the young person. And that has to be about focusing the support around the young person. And I've met so many of those youth workers in that setting to say I think they have a special skill to reach out. And it's about consistency, it's about listening, it's about providing continuity, and it's about helping to foster confidence and an alternative route in their life. And all of that happens. And therefore, I do think there is a bit of a misnomer when we call it a reachable, teachable moment, because it's a reachable, teachable moment only insofar as that is a place at which you can start a conversation. But clearly it's fairly meaningless, actually, if that is the only place the conversation takes place, or it's not as profound, perhaps is a more accurate way of putting it. This is all embedded in a much longer term relationship, and as I think our previous contributor said, over a period of time that suits the young person, and it needs to have that inherent flexibility in the approach. So for me, there is a whole series of things around the quality of the relationship, and then there is of course the support given to the people providing that relationship. And I'm really pleased to see the equipping of the caseworkers for the demands of the role, the acknowledgement that youth work has by and large been degraded over the last sort of 14 plus years, and that this is an opportunity for us to speak to it in its broadest sense, but also in this specific sense as well. And supporting those people in that really, really tough engagement with somebody who's come in and suffered from violence has to be key. The bit I also want to draw out on before finishing is 2 quick points. One is around partnership, which I think is critical. And I think other speakers have mentioned it in the context of other, youth work schemes. For me, this is all about relationships and partnerships with young people, but the partnerships that we can actually foster in a local level and at a strategic regional level. So why I use the word investor is there is so much more than just a commissioned service in a particular place. We have been able to unlock strategic partnerships and making sure sometimes the police, where relevant, are in the conversation. Sometimes the NHS across London is relevant in the conversation to help support what is going on at very local level. That ecosystem, that partnership is absolutely key. And I'll draw your attention, and maybe Caleb can provide a link to the social finance report that talks about the process that has happened and seems to me to be really, really key, as well as the relationship. And then finally, looking forward and sort of extrapolating from these recommendations, what that looks like as you go forward. I think there's got to be greater data analysis. There's got to be greater sharing of what's going on in the different hospitals. There has to be increased join up with different programs in terms of community connection and community links across all sorts of partners, embedding that relationship in with others. And then finally, the long-term funding, which is, I know, the piece you're coming on to next, but it seems to me absolutely key. We are very pleased as a VRU. We have just received notification of our funding going forward, but it's for the next year, and I don't want to pour scorn on what is positive news. But come on, guys, this is a long-term problem. This needs long-term investment, and we will do that with the backing of the Mayor, but we will also need backing of government to be able to do that as well. So just some reflections there from me. Thank you very much.
Yeah, thank you, Lib. And what a zoom out for context, people, the possibilities of relationships, strategic relationships, partnerships, relationship with young people, ecosystem. And come on, government, with your national youth strategy, there's an opportunity here, and we're all lining up to support and help you. Chloe, back to you. Thank you, Lib. Appreciate it.
Thanks so much. And I'm moving on now to talk about the final theme, which is strong foundations. It's going to be a bit truncated because I'm conscious we don't have much time left, but I'd encourage you to go away and look at it in the report. Before we move into this one, I want to highlight that we're aware that as our kind of audience, you as commissioners and funders, you're limited in what you're able to do, considering the kind of limitations of the current system. And we will be working on writing system guidance for the youth sector, which will be directed at policymakers about the kind of fundamental system changes that we need to see to enable you as commissioners and funders to actually do what works. So I'm conscious that although we're saying, fund these things and use multi-year core funding, that you do have some limitations in what you're able to do. And we're looking to in the next 6 months, develop recommendations for policymakers to make it easier for you to fund this high quality youth work that we're talking about. Having said that, I'll dive into what I do think you can start by doing at the moment in terms of strengthening the foundations of youth work in your area. And the first recommendation here is to make multi-year core funding for youth work the default. We know that short-term restricted funding can weaken the quality of youth provision, and so we're encouraging you here to offer funding that lasts at least 3 to 5 years. And I'm going to delve into this one because I think this is the most challenging of the three. We're recommending multi-year funding because it can make the most of limited resources. We know that the resources are limited, but youth work organisations often kind of are funded for 1 year, and then they're funded for the next year, and then they're funded for the next year. And that limits their ability to plan and to develop staff and to retain staff and maintain those trusting relationships. But actually that same amount of money is being spent just called by year rather than over that 3-year period, and providing that sort of 3 or 5 year commitment can, without actually adding any cost, really increase what youth work organisations are able to do. So we encourage you to plan to move to a multi-year commissioning cycle for youth work. And this could involve kind of awarding multi-year grants or contracts that are subject to annual budget where required. We know that many people who are listening today receive an annual budget, and that makes it difficult to then provide multi-year commitments. But using a contract that has that kind of subject to annual budget can give more certainty to youth work providers whilst retaining that flexibility that you need. There's more detail in the report and a case study of a local authority area that does that. You can see in the report there. Now, it's not always an easy case to make, to sort of shift to this multi-year funding. We encourage you, and there's more detail on this in the report, to emphasise the preventative value of youth work. One study found that for every £1 saved by shutting youth clubs, there were almost £3 in losses from kind of higher crime rates and lower educational returns. Positioning youth work as a statutory duty rather than a discretionary spend, highlighting value for money. Multi-year funding can reduce the kind of re-procurement and reporting burden for both funders and providers. And finally, stressing the importance of a skilled and stable workforce. Insecure roles is a key reason why people leave the field or never enter the field. And then asking other local funders to contribute to the local youth offer and align with the multi-year approach. And there's more detail in the report on that as well. It's not just about providing multi-year funding, it's also providing funding for core operating costs. So things like monitoring, reporting, data collection, staff development, those are really key costs. And ultimately, if those are not included, over time, that can weaken the quality of youth work in your area. And then finally, funding providers to collect and use data to improve quality and inclusion is really key. I'm going at pace now because we don't have long. The next recommendation here is to strengthen foundations of youth work in your area, is to equip youth workers to safeguard children and young people. Now, they're already doing this. We're not saying this because they're not safeguarding young people. It's because they are, but because they're often doing it without the necessary support. So this is about funding regular supervision and training for youth workers who are supporting vulnerable children. And this should include kind of specialist training that covers violence prevention, child criminal exploitation, and emerging issues in your area. And the one that I'm going to delve into here is B, involving youth workers in local safeguarding or community safety systems. The research that we funded found that involvement in safeguarding systems, youth workers' involvement varies really widely. There are even some local authorities where actually involvement in youth workers' involvement in safeguarding systems is rare or non-existent. That was about 1 in 7 local authorities who reported that. And youth workers are on the front line of supporting many of the vulnerable groups that we've spoken about. So it's key that they're involved. It's important that their specific role is recognised. Youth work is a consent-based profession. It relies on that trust that vulnerable children and young people have in youth workers. That's different to social workers or policing, who can sometimes do things without the consent of the people involved. So it's important that the role youth workers play in a safeguarding or community safety system kind of respects and reflects their unique role. The first element here will be to identify, what the pathway is in your area for responding to children and young people or contacts who are impacted by violence. That varies across different local areas as well. And then it's about identifying gaps in youth workers' contribution. There's a kind of workshop example that we include in the guidance to help local areas do that. And finally, improving youth workers' contributions to the local response. Sometimes youth workers are actually, attending meetings but not really taking part. There's a quote there on the screen from a youth worker who was interviewed as part of the research, talks about how actually they are invited to meetings, but actually they don't have that sort of ability to contribute and their role isn't recognised. So we suggest a range of ways in which you could improve youth workers' contribution to the local safeguarding or community safety response in your area. And our final strong foundation is to prioritise evidence-based strategies and avoid harmful approaches. We know that resources are limited, and those limited resources are best spent on violence prevention strategies that are supported by evidence. I want to focus here on using robust evidence to inform decision making. And we'd encourage you to use our toolkit, the EF toolkit, which summarises 39 approaches to violence prevention and the evidence that is either there or not there for those. And I wanted to draw your attention to two other violence prevention strategies, which are not delivered by youth workers, but which can be delivered in a youth work context, for example, through co-located services. The first is cognitive behavioural therapy. It's a talking therapy which is used for many psychological difficulties. And there's good evidence that cognitive behavioural therapy has a high impact on reducing involvement in violence. And then the second is relationship violence prevention lessons and activities. These aim to reduce kind of relationship violence in intimate relationships. And they're often delivered in schools, but they can also be delivered in youth clubs. And these are both evidence-based ways to prevent violence. Now, there are strategies that don't have evidence. We highlight that when we talk about recommendation B. There's currently a lack of evidence for things like detached youth work. There's lack of direct evidence of the impact on violence, for trauma-informed practice training, for knife crime education programmes. And if you go to the guidance, you'll see we've got a kind of nuanced message for each of those, because the sort of state of the evidence is slightly different. And we're working always to improve the quality of evidence in these areas through the trials that we're funding. And then finally, avoiding approaches that have been proven to cause harm, which includes prison awareness programmes and boot camps actually have a negative impact on children and young people's risk of becoming involved in violence. All right, we've covered kind of the key takeaways, the key practical steps that you can take to protect children and young people in your area by focusing on the most vulnerable, funding approaches that work, and strengthening the foundations for high quality youth work in your local area. We could spend a whole day going through the guidance. There's lots more detail, examples, useful links in the report itself, not to mention all the sub-recommendations, which we didn't have time to talk through today. So I'd encourage you to go ahead and delve into the report. I'll hand back to Caleb. Thank you so much for your time this morning.
Yeah, thank you, Chloe. A hugely fantastic job there. And a huge thanks to colleagues internally as well who have helped to bring and galvanise this guidance together. We've got time for probably just one question, 3 minutes if it's a good one. When I look through the questions, a lot of it has been answered. There's a few people that we'll get back to directly. But what I did want to say is that this guidance is the start of mobilizing the evidence, really. And if you commission, fund, or influence youth provision, then definitely download the guidance. I would share it with colleagues far and wide at different ranks and levels, and use it to challenge existing practice, things that should be funded, things that shouldn't be funded based on the context of vulnerability, and most importantly, embed it locally. This is written for commissioners and local funders for a reason, because as I've seen in much of the comments, many are talking about the level of resources and funding available to do what is being requested in the recommendations, and two, making sure that there is more than enough in the wheelhouse for you to respond to this. So commissioners and local funders is the key audience here. And you know, because preventing violence from affecting young people isn't about doing more of everything. It's about doing the right things in the right places for the right children and doing them well. There is an efficiency element here, which has been really strongly suggested by our guest speakers, Junior, Abby, Jacob, and Liv. And just a huge thank you for joining us in that regard. So we got time probably for a question and a response. So anyone wants to put their hand up as we close out? I think people are dropping off now. Look, this is the beginning of probably a few VLCs where we'll dive deeper into the evidence. And again, if you've got a commissioner, local funder, and you're here, look at the guidance. If you're working with a commissioner, local funder, then share the guidance. Lucy, shoot. You got. We'll have to
Just
skip
unmute
you.
myself. Hi there, everyone.
Hi,
I'm
Lucy?
based in Stockton-on-Tees, working for the Corner House Youth Project. So we're northeast of England. We've got some really significant issues in our area with serious youth violence and child exploitation. I am just interested to hear from, are there any other areas on this call or that you're aware of where the local authority aren't funding any VCS youth services?
Yeah, let me just throw that to Abby, who's probably best placed to quickly respond to that. There's a mix of different LAs who commission, not commission, and then statutory duty. And I think one step from this guidance is pushing colleagues to think about, if there's violence happening, what are you doing? You've got an action, and it's something for us to think about. But Abby, you know, last 30 seconds is yours.
Yeah, I guess I'd echo what you said, Caleb. And I think it's important as well to contextualise violence in the wider sense. Like, we're not just talking about community violence or weapons-enabled violence. We're also talking about interpersonal and relational violence. That's in all of our communities. So it's about how we're having those conversations with local authorities to go, look, we know things are tough, but we're part of the solution. And so how do you bring us into the work that you're doing so that we're all working together? There is a few little networks that you can join. UK Youth have a really good network for voluntary sector organisations where people can talk and support each other. There's a local authority network, an officer community that we run for DCMS. So look, just send us an email and we can connect you with people that might be helpful. I think that's probably the best way.
Yeah, because I think we are having all of those conversations and we're raising the profile of what we do and the cost saving and all of the things, and we're linking with multiple different departments of a local authority, but no further forward in terms of discussions around, you know, commissioning services from the VCS.
Well, I'd say
we'd definitely be interested in exploring a further conversation around that.
Yeah, get on the website and pull the statutory duty guidance. Local authorities have a statutory duty. Get it in there.
Yeah. I was just interested to hear if other people are having any similar sorts of issues.
We can connect you.
Yeah. Okay, cool. Thank you.
And Lucy, just we're developing a tool for commissioners to align to the recommendations, which will help to spark that conversation and focus. So yeah, definitely watch this space. We'll be communicating with everyone that signed up to this. Well, listen, we're 1 minute over, and I just want to say a huge thank you to our colleagues that joined us externally and supported the recommendation. A big thank you to my co-pilot Chloe and Yanina in the background for the work we're doing, and lots of people inside and externally, and the expert panel members that we've worked with, and lots of other people we chatted to over the last kind of 12 to 16 months. We really do appreciate you and hope this is the start of something special. So stay tuned and have a superb day.
Thank you.
It's all.